today with a very interesting topic. It's both important in terms of pharmacology and also toxicology, and you will see uh, these patients toxic getting like the toxicity of such drugs in day-to-day life in your emergency room too. The topic is about, as we know that we have, the topic is anti-cholinesterase. We have cholinesterase inhibitor, which is the irreversible. So the drug will be irreversible, right? Irreversible um, cholinesterase, cholinesterase antagonist, yes, antagonist or blocker, which means that is an app. This is an irreversible acetylcholine agonist, which means that the drug binds to acetylcholine but does not allow to, it does not release back. So it binds to the acetylcholine stays for longer time. Let the acetylcholine stays at the neuromuscular junction for relatively for that means irreversibly. So there are two classes here. The one that we know is one of them is organophosphates, and we know organophosphate is not just one drug; it's a class of drug which is used in, they are toxic drugs, but sometimes we as humans or animals, they get, it gets absorbed into the body and can cause toxic effect. For example, we know that, and there's one more called carbamate. Carbamate is almost in effect same to like organophosphate, but it's not an irreversible inhibitor. However, the mortality is almost the same. So we should remember that there are two drugs we call the organophosphate, one of them, and the other one is carbamate. Now we have, if we talk about organophosphate, there are a lot of drugs here. For example, in the, in warfare agents, like we have the warfare gases. There are gases like soman, they are the gases. Then we have sarin, they are the gases in warfare agents, though they are banned. However, there's, in some example, they were used there against the enemies. um, that's one. And we know something called parathene. Parathene is as insecticide. It was used, it's an insecticide. It's historically used in agriculture, but it, also in our, day-to-day life, if we want to use insecticide, there was also organophosphate, and a lot of people did have toxicity. So, how does it work? Now, it works by irreversibly binding to, acetylcholinesterase. Now, there is one thing that we should remember. So, um, in the past, yes, we said that it was poisoning usually seen in farmers. You could easily take it by different ways, by the help of with the help of GI, by ingesting it, because you don't, by mistakenly you took it, or sometime people don't clean, properly, wash the fruits or vegetables, or sometime, at homes you're using as insecticide, you can inhale it, or maybe taken from dermis, or as gases, as we said before. There's a very famous case in that took place in Pakistan, in Karachi. One family was staying in a hotel, and children were sleeping on the floor of the hotel, which were the management of the hotel had used before insecticide. So children sleeping on the floor, they later died. Initially, they thought that it could be caused by the food that had been bought from outside, but later they found that it was actually organophosphate toxicity. So it could be taken by different ways. We should remember that. Now, once acetylcholinesterase, once organophosphate or carbamate, or mostly organophosphate, it binds to acetylcholinesterase. It inhibits it, but then what happens after some time? what happens is it brings a conformational change. It means a structural change. Initially, it can be reversed, but after some time, it cannot be reversed, and this process is called aging. So if you want to, disconnect acetylcholinesterase and organophosphate, what happens is initially till it gets aging, you can, reverse it. After that, you cannot reverse it. So we need to give medication. We need to give antidote. There's a particular antidote which removes or which disconnects these two stuffs, acetylcholinesterase and organophosphates, till it ages. And ages is different from, it's different from drug to drug. For example, in Soman, it is about 2 to 6 minutes. For example, in Serine, it is slowly aging. So it means the window of treatment of antidote is relatively longer. And, in Parathene is actually it is one of the it's a prodrug, and the liver changes into another substance called peroxan, and then peroxan actually is the active. So it's a prodrug, so it relatively takes time till it ages. Now that's why it's important. For example, in Soman, it's just 2 to 6 minutes till it ages. It means it's irreversible. So there's an antidote that is called peroxim. You should give it within this short. The window period is relatively short. And we also know, for example, in serine, it's relatively longer. That's why the window to till you give antidote, it's relatively longer. Same is for parathene. So you should remember there are different ways. Now, what does it do? Since it is a muscarinic agonist, what happens? It's a acetylcholine agonist. It increases acetylcholine activity. So there are different ways. For example, if it increases parasympathetic activity, for example, let's say, which means parasympathetic activity, so you could say it can cause bradycardia, it can cause bronchoconstriction, and it can cause meiosis, smooth muscle contractions. So you should remember. So, for example, in GI, it can cause vomiting, diarrhea, smooth muscles. All the secretions are going to increase. Any secretions that we have salivary gland, secretion from GI, bronchial secretions. All this, we know that parasympathetic increases all of them. And also, we studied that it caused diaphoresis, which means sweating, because we know that acetylcholine is also released in the sympathetic part. We should remember that. So it's important that is there. And we said that this is one. Then we said, how about if it also increases, it also increases acetylcholine at the neuromuscular junction. Some people have fasciculation. What is fasciculation? Not the whole bundle of muscles they contract, just part of the muscles contract, and it causes, like fasciculation. Part of the muscle contract, it causes severe pain. They are really painful, and sometimes, as because it works too much, eventually it causes depolarization, blocking completely flaccidity or weakness of the muscle. Since it works on the central nervous system, so in the central nervous system, it can cause agitation, it can cause confusion, coma, respiratory depression, and seizure. So you should remember that it's not just parasympathetic, it's part of sympathetic. Also, it's causing, severe somatic muscles, which is causing contracture, and also working on the central nervous system, acetylcholine there. So it's not just that one part. Now the question is, so we said that on the muscarinic it can cause diarrhea, so that's how they remember. We call the dumbbells. So D for diarrhea, D for U for urination, parasympathetic again, meiosis. Okay, so bronchospasm, just like asthma-like effect, bradycardia, emesis, right? Vomiting, lacrimation, sweating, salivation, all these secretions are increased. We should remember that. And this is one. And second one is nicotinic effect. So what about the nicotinic effect? I just told you the neuromuscular effect. It can cause other stuffs. I just talked about it. I said it can cause fasciculation, or even sometime complete relaxation of muscle, and sometimes it can cause seizure like. And then central nervous system, I said respiratory depression. That's what I said. lethargy, seizure, and coma. Now the question is how to treat it. The first thing is you should remove, completely the dilute the toxin that's there, completely remove the person from the pot where he is. So that's the first thing, right? Clean the area and whatever, wash whatever you have. That's the first thing. Second thing is you can give, till I just told you, we can, the antidote is preladoxin. What does preladoxin does? It removes, the connection, or it removes that organophosphate with acetylcholine-estrase. It means regenerates, but it can work again. It can work till aging, because after aging there's a conformational change, it does not work. Now somebody asked me how long does it take. My answer for him or her is that depends on the agent that we just discussed. I told you, for example, for salmon gas, it's 2 to 6 minutes. For sarin, it is hours. And for, I said parathunes, it is in hours. Normally we say, within 2 to 6 hours we should, but for salmon it's really relatively faster. So you should remember, how does preladoxin work? It just works on the peripheral nervous system, does not work on central nervous system. In addition to that, to treat all the parasympathetic system, we can give atropine. Atropine is antimuscarinic, so all these effects can be decreased by the atropine. For example, diarrhea, urination, meiosis. Since the half-life is of atropine is relatively shorter, so you need to give the drug again and again. And the last part is you can give, because patient can go into complete, you know because of because it patient can go into lethargy and seizures. You can give diazepam, but you have to be careful not to cause respiratory depression a lot. Thank you. Hope to see you with another lecture.